Good afternoon, everyone. Thank you so much for joining us to our Healthy Homes First campaign kickoff webinar. So again, I say good afternoon and welcome. We're so glad that you've joined us today at our Healthy Homes First webinar, and I am Ewa Vosper. I'm the Federal Policy Manager at We Act for Environmental Justice. At We Act, we work to ensure that communities of color and low-income communities can live in environments that are healthy, equitable, and resilient. And today's conversation is at the heart of that mission. So what is the reality that we're facing? Well, right now, in too many communities across the country, families are dealing with moldy walls, broken heating cooling systems, drafty windows, rising utility bills, and worsening asthma. All while heat waves, floods, and cold snaps intensify. The systems meant to protect our communities are strained, are under attack, while most vulnerable communities are left to cope alone. So why does Healthy Homes First matter now? Well, this isn't just about buildings. It's about breathing clean air inside of our homes. It's about not choosing between paying rent and staying warm. It's about the dignity of a safe home that doesn't harm your health. Healthy homes are the foundation of public health, racial equity, climate resilience, and economic justice. So at the moment we're in, energy efficiency programs are on the chopping block. Cuts to key federal agencies like HUD and EPA and environmental regulations are under threat. Our response must be bold and people-centered. That's why we're proud to launch the Healthy Homes First campaign, an urgent push to ensure no one is left behind. So what can you expect to hear from today? Well, leaders who are on the ground and in the data, who are fighting for better housing, fair energy systems, and healthier communities. And we'll talk about how you can join us in moving this forward. So to start us off, I'm thrilled to introduce Leslie Fields, who leads our Federal Policy Office, who will bring a powerful perspective on advancing healthy homes alongside equitable building decarbonization, and show us how justice cannot afford to be delayed. So I pass it on to you, Leslie.
Thank you so much, Ewa. Good afternoon, everyone. Thank you all so much for joining us this afternoon for this very important topic and issue. I'm Leslie Fields, the Chief Federal Officer for We Act for Environmental Justice based in Washington, D.C. And so to remind you all that We Act was founded in 1988 in response to environmental hazards and resulting health disparities in West Harlem, New York, where our main office still resides. And there was issues including the North River sewage treatment plant and multiple bus depots that were plaguing this community. WEAC's mission is to build healthy communities by ensuring that people of color and low-income residents participate meaningfully in the creation of sound, fair environmental health protection policies and practices. And so this is why we have offices in Harlem, New York, and in Washington, D.C. For the places that we spend most of our time, our homes should make us feel safe. Yet, for Black, Brown, and low-income folks around the country, especially residents in public and affordable housing, this is far from the case. Discriminatory policies, underinvestment, neglect have made living in their homes costly and hazardous. People of color disproportionately occupy substantial housing living substandard housing, living with the reality of a number of indoor health hazards like mold and pests. If you're a Black child, you are more likely to be exposed to greater levels of lead. Gas stoves release toxic pollutants that worsen respiratory illnesses like asthma and may increase cancer risks. For communities of color who most likely live in smaller, older homes with inefficient appliances and poor ventilation, these health risks are even more severe, compounding the issue these communities endure higher levels of harmful outdoor pollution. Our communities also bear the brunt of the worst climate crisis impacts, including extreme weather. Extreme heat is the deadliest impact of climate change in the United States, harming environmental justice communities the most. In New York City alone, where WEACT is headquartered, 50% of the heat-related deaths are among Black people, despite making only 25% of the city's population. Older, poorly insulated housing increases exposure to extreme temperatures for communities of color and low-income households, heightening the risk of heat-related deaths and illnesses. Coping with extreme heat will go even more difficult as climate change intensifies and energy prices continue to rise. Studies show that people of color and low wealth spend a higher percentage of their incomes on energy costs. Higher energy burdens also cause these households to make difficult trade-offs, such as cutting back on cooling and heating during extreme weather events, which can exacerbate health challenges. Poor heating and cooling worsen respiratory issues, uh, health-related illnesses, and cardiovascular stress, while inefficient appliances and insulation degrade indoor air quality, increasing asthma and chronic disease risks. All these factors mean that our communities are frequently excluded from energy efficiency upgrades, retrofits, and access to clean, affordable energy. This forces them to endure inefficient, unsafe, and high-cost homes that worsen health issues. Addressing these disparities is essential for ensuring a just future for all. The We Act Healthy Homes legacy includes, we define a healthy home as one that not only avoids health and safety threats in the built environment, but also promotes physical, mental, social, and environmental well-being. Living every day in an unhealthy and indoor environment is a violation of basic rights, and environmental justice communities deserve to benefit from the transition to a clean energy future. WEAC has long-standing legacy of leadership in reducing exposure to toxic chemicals and indoor health hazards, advocating for safer environments through pest control, lead, mold remediation, and transitioning homes and buildings away from fossil fuels. For many years, WEAC has worked with members throughout New York City, Housing Authority, NYCHA, and the Healthy Homes Working Groups to identify common struggles and implement holistic, evidence-based policies that create and sustain healthy housing and safer indoor environments for all New York City residents, especially low income and people of color. In 2021, we launched a pilot program called Out of Gas in with Justice in New York City that included air monitoring and controlled cooking tests in 10 apartments with induction cooktops compared to 10 with gas stoves. On average, the nitrogen dioxide concentrations in apartments with gas stoves were 190% higher than those without. Households with induction cooktops saw a 35% reduction in daily nitrogen oxide concentration. Residents remarked about the ease of use and reduced cooking times with electric induction stoves and experienced health improvements, including fewer asthma symptoms. This study provided evidence to decision makers that building electrification can be done equitably, lowering indoor air pollution and benefiting residents' health while supporting broader climate goals. So, building on our successes in New York, we are expanding our efforts nationwide through the Healthy Homes First campaign. This initiative is a bold call of action demanding that everyone has access to safe, healthy, and affordable housing. No exceptions. Every day we see our utility food bills rising and real-time impacts of the climate crisis. Meanwhile, the current administration has made targeted attempts to block historic incentives for home energy efficiency upgrades, weaken environmental protections, and undo climate resilience and mitigation efforts, remove key agency staff responsible for programs helping millions struggling with high energy bills. Now more than ever, we must put healthy homes first, ensuring that environmental justice communities receive the necessary maintenance, upgrades, remediation of indoor health hazards to meaningfully reap the benefits of building decarbonization. As we embark on this important campaign, it is clear that collective action is the key to lasting change. I'm excited for what's ahead. I know we're laying the foundation for something impactful. And to share more details for our vision for the Healthy Homes First campaign, I will pass it back to my great colleague Ewa. Thank you very, very much for being here. And we look forward to your questions and involvement. Back to you, Ewa.
Thank you. Thank you for your insightful remarks and that powerful framing. So now we're going to tell you a little bit more about some of the policies and advocacy steps we are taking in the campaign. So as Leslie mentioned, regardless of race, background, everyone deserves a healthy home, and we look at that holistically. Next slide, please. So our mission is to advance healthy, safe, pollution-free buildings to improve health and living conditions for environmental justice communities, especially in public and affordable housing. So what are some of our goals? Well, we're going to build awareness for advocating for justice. We're going to elevate the topic and make sure it's top of mind in the community with leaders, with council. We are going to collaborate with people on the ground and people who are experiencing these issues firsthand, because we don't speak for the community, we speak with the community. Next slide, please. So what are some of our federal policy steps? So our federal, on May 22nd, WEACT and our environmental justice partners co-hosted a critical roundtable with members of Congress and convened meetings with federal agencies. Our goal was simple: to center the needs of low-income communities and communities of color in public and affordable housing as we advance equitable electrification and healthy homes. We emphasize the urgency of not only cleaning up the air inside of our homes, but also making the energy transition affordable and accessible for all, especially those who are constantly and all too often being left behind. So as I mentioned, as an overview of the campaign, our legislative engagement included being active on all and many legislative fronts. WEACT provides feedback constantly, and we also work to elevate bills that we think are important. Some of the two key bills we have given input are Representative Tonko's Indoor Air Quality and Healthy Schools Act, which focuses on improving air quality in educational settings, and Senator Markey's Heating and Cooling Relief Act, which supports energy affordability for vulnerable households. These pieces of legislation are essential steps toward tackling energy poverty and improving indoor air quality for our most at-risk population. And right now, at the forefront of our minds is LIHEAP and what has been happening around that. So that's a major effort. And if we don't know, LIHEAP means Low Income Home Energy Assistance Program. And WEACT has led a sign-on letter joined by 20 environmental groups and 30 allied organizations. We're calling on Congress to increase LIHEAP funding on the authorized level. And we want to emphasize that energy should not be a luxury. It is a human right. And programs like LIHEAP must be robustly funded to ensure families are not forced, again, to choose between heating their homes or putting food on the table. So as we look ahead, we want to hold more accountability. We're calling on all levels of government to strengthen indoor air quality guidelines and energy efficiency standards, set zero emission appliance benchmarks, reform existing programs to better address indoor health hazards and build climate resistance for public housing. And these are not just important environmental upgrades, it's about protecting health, ensuring housing dignity, and securing justice. We'll continue to champion investments and legislation that improve indoor air quality, address energy burden and affordability, advance energy efficiency and electrification, and expand access to clean, renewable energy for low-income households and communities of color. So I am honored to transition and introduce Jamila Ba with Action in Montgomery, a vibrant grassroots organization rooted in Montgomery County, Maryland. The aim is a broad-based, multiracial, multi-faith citizens power organization that has long been a leader in organizing communities to drive systemic change. So Jamila, take it away.
Hi, thank you. Good evening, everybody. Good afternoon, everyone. My name is Jamila Ba, and I'm with Action in Montgomery. We are part of the Just Power Alliance, which is also in Wisconsin, Ohio, Massachusetts, Connecticut, DC, and Virginia. We build the organized people power to act in issues that are important to people in our community across faith, race, socioeconomic background, age, and more. In AIM, we have won over $1 billion for affordable housing, quality after-school program in 18 low-income schools, new school buildings, and much more. Second slide, please. In 2023, I joined our climate team doing NO2 testing in people's homes, mostly low-income tenants. We will cook with them while we're doing testing, making rice, tortilla, and more, whatever they love. We use the time to get to know them, to figure out what issues were important to them, and to build a strong team of tenants who wanted to work together for cleaner, healthier home. In most homes, after 15 minutes, the stove were on, the NO2 level were higher than the EPA recommended for outdoor air, which is 100 parts per billion. Sometimes the bedroom had higher NO2 level because it traveled. So nowhere in the apartment was safe. NO2 causes asthma, respiratory illness, and affects brain development in children. Third slide, please. We have tested more than 400 homes. We create a report, Cooking Up Danger, that we hope you will check out. Ashley, would you please put that in the link? Thank you. The link in the chat. Thank you. We have learned that no matter where you live, gas appliances are a health problem. However, homeowners have a choice about their appliances, and tenants do not. We wanted to make sure tenants have a choice too. Everybody deserves to live in a decent home and breathe clean air, especially in places where we call home, with dignity. We have used our testing and report to teach elected officials about the need to move from dirty gas to electric energy. Fourth slide, please. We have invited many elected officials to our home to do testing so they can learn firsthand the danger of gas appliances to people, health, and safety. Next slide, please. We have worked with other organizations to educate our elected officials on several bills that will make a real difference in our lives. We fought to pass the Empower Bill in Maryland that makes sure funding goes to electrify low-income housing, including apartments. This is 400 of us at Good Hope Church with elected officials holding up the number we tested in people's home and asking for electrification. Next slide, please. We work to pass building energy performance standard at the county and state level, which regulate large buildings to change from gas to electric, including many apartment buildings. They call it BEPS. Next slide, please. We also work to pass STRIDE reform so gas company cannot charge crazy fee to expand gas pipe and infrastructure, which will help keep our bills low and move to more electrification. They will also have to prioritize safety concern. We had a meeting with 750 people before our legislative section and brought more than 200 people to talk in person with over 50 senators and delegate offices to support electrification, affordable housing, and other issues. We are working with Washington Gas, the Maryland Energy Administration, tenant and landlord, to install network geothermal and solar energy to electrify thousands of apartments and home units across the state. Next, we hope to build a working relation with the Public Service Commission, which oversees the implementation of many of these bills, which is the PSC. So that's all the work we've been doing so far at AIM and the other organization. Thank you. Like we said, everybody deserves to have a decent home and breathe clean air.
Thank you so much. Now, I am pleased to introduce Jessica Mason, an analyst with Embold Research. Jessica brings a sharp analytical lens and a deep commitment to equity in her research. Today, Jessica will be sharing findings from Embold's latest survey work that helps illuminate how people across the country think and feel about healthy homes, electrification, and energy equity. So please join me in welcoming Jessica Mason.
Hi, Yuva. Thank you so much for that introduction. I am so happy to be presenting this data on behalf of the Healthy Homes First campaign and WE ACT. Like Yuva said, I'm an analyst at Embold Research. If you don't know who we are a nonpartisan public opinion research firm that has been active since 2017. And our aim is to leverage polling and public opinion research to make a more humane and just world. With this particular survey that we conducted on behalf of WE ACT, we have actually two different samples here that we looked at. First, we talked to over 2,000 registered voters nationwide, but then we also talked to 600 low-income people of color in 3 key cities, New York City, Chicago, and Houston, to be representative of the communities that we seek to collaborate with and uplift. It's important to note here that we're going to be treating these two groups separately, but I will be sure to point out meaningful differences where relevant. We also have a lot of information that we're going to cover here, so we will be posting this slide deck for everyone to review as well. So just to give a brief look behind the curtain methodologically, for our main sample, we really tried to get representation of voters of all stripes at the national level. We also want to give a look behind the curtain of who the folks in our oversample are, folks who are in the communities that we are trying to do outreach with. What's important here in this presentation, if I want you to take away one thing, is that for the communities where it matters most, low-income communities, communities of color, we see that concerns around the health effects of in-home gas use are high, access to electrical appliances falls short, and that there is significant support for a transition to clean energy sources. One of the first things that we found when we were asking these people about energy usage is that rising energy costs are a central concern when it comes to issues with housing. This concern is grounded in the reality that costs have increased for most. And we see in low-income communities and communities of color, they're also really concerned about the health impacts, not just the cost impacts of in-home gas use, but they're also the least likely groups to have access to electric appliances in home. Another really essential finding that we see is that the Low-Income Home Energy Association Program, or LIHEAP, receives not just substantial support, but also bipartisan support. We also see that LIHEAP receives overwhelming support from the voters who experience the greatest risks from extreme heat and energy burdens. Last but not least, we did do some message testing, seeing what resonates with voters and these communities when we are talking about these policies. And we see that what resonates the most is a message centered on racial equity, housing affordability, and better health outcomes for all. The first thing I want to discuss is this topic of electrification in a broader context. We see that first, among a national population, there's a widespread adoption of electric appliances. Less than 3 in 10 voters say that they have no electric appliances in their home, and over half say that they have an electric stove or induction cooktop. However, there are some key groups who are not experiencing that same level of electrification. Among our national audience, we see that voters of color and voters in urban areas are more likely to be without electrified appliances. Even more concerning, when we look at the communities that we care about most, these low-income communities of color, we see that over half, 52% of these respondents have 0 electric appliances that would replace gas appliances in their homes. When we zoom in and we look at folks who are either current or past public housing tenants, 2/3 say that they only have gas appliances where electric appliances could be used. We also see that large majorities of the people we talk to have faced rising costs in housing and energy in the past year. You'll see in this graph, we show both the percentages of that voters nationwide and then our low income sample. And for both groups, rising costs is a widespread phenomenon. But what's really notable here is for our low income folks, the feeling of housing cost increases is much more acute than voters nationwide. We see this particularly coming from our folks who live in New York City. 83% say that their housing costs have increased a lot in the past year. And when it comes to housing concerns, when we look at the national level, we see that folks are primarily concerned about cost, both energy costs and housing costs. But also, it's important to note that home health hazards do gather concern, particularly among renters and voters of color. Though it may not look like a top issue nationwide when we're looking at that set of gray bars, majorities of voters of color and majorities of renters are concerned about indoor air quality and the presence of in-home health hazards. When we also zoom in and look at low-income people of color, these concerns, both economic and health-related, are felt really, really prominently. Majorities of these folks are concerned about all of these items that we tested here, although cost does rise to the top slightly. I think it's also important to call out here that each of these cities have a unique landscape, and so these concerns sort of vary city to city. I think a key example of this is that in Houston, power outages are a near universal concern, much more than they are in Chicago and New York City. And this is very much tied to Houston's and Texas's history of blackouts and brownouts during bouts of extreme weather. So the last piece of context that I want to add here is one of the most important pieces of context that we gathered, in my opinion, which is we asked voters directly, what does a healthy home mean to you? 3 themes sort of came up across our 2 groups, mostly nationwide, and then looking specifically at low-income voters of color. The first is a holistic vision of health that extends outside the home. The second is a sense of safety and security. And third is, at a bare minimum, housing that is free of health hazards. However, there is some nuance. When we look at a national audience, we see that a holistic health vision is more abstract and environmentally focused. There's a desire for clean air, clean water, free of toxins. But when we zoom into our low-income communities and our communities of color, we see a picture of a more detailed, communally focused health vision, one that asks for shared green spaces, access to affordable healthcare, more grocery stores with better, healthier options. We see a similar nuance in the conversation around safety. In a wider audience nationwide, we see a focus on physical safety, a desire to feel physically secure in the home, and a desire to be in low crime areas. While physical safety was also mentioned with these other communities, our low income communities of color, what was much more prominently cited when it comes to security was emotional security, emotional well-being, and a feeling at peace, the desire for the home to be a place without stressors. Then we wanted to dig into a little more detail. What do voters know about the negative effects of oil and gas? And what we see is nationwide, less than half, 46%, are familiar with the negative effects of using gas in their home. Additionally, just over 1 in 5 voters at a nationwide level believe that no negative effects of gas exist, which is unfortunately becoming an increasingly partisan issue that we see in our data. However, I think it's important to see that respondents from our low-income voter of color sample are much more likely to be familiar with these negative effects, with very few refusing to believe that negative impacts exist. We do see that familiarity vary slightly by city to city, but we also saw, like in Houston, that they're slightly more likely to have electrified appliances. So there is a relationship here, we think, between the awareness of the negative effects and whether or not you do have electric appliances in your home. We then asked our low-income respondents of color where they have heard about these negative effects. And we're seeing that the most common channels of communication are TV news, followed by social media and online news. These are, the channels that we will be wanting to use when communicating with these communities. There's a pretty strong reliance on television news, but social media, word of mouth, looking things up online are also pretty common. Looking beyond awareness, we see that voters of color and renters are most likely to be concerned about the negative effects of gas use in their households. And while we do see that only 28% of voters generally at a nationwide level are at least somewhat concerned about the negative effects of household gas use, it's important to keep in mind that these households are more likely to be electrified, resulting in these concerns feeling less personal to them. So in the groups that we're thinking about who are less likely to have, electric stove, electric heating in their homes, these folks have significant levels of concern about these negative effects. To that point, we see that when we look specifically at our low-income respondents of color, over 6 in 10 say that they're concerned about the negative effects of gas. We also see that the majorities in all 3 cities are at least somewhat concerned. And when we're looking at our public housing tenants, nearly 3/4 of them are concerned. Again, a very high connection between having no electrified appliances in the home and very high concerns about the health impacts. We then asked voters more explicitly about the health and safety risks associated with in-home oil and gas use. And we do see a pretty significant difference between voters nationwide and voters living in these environmental justice communities, these low-income communities of color. The lack of concern that we see at a nationwide level is largely led by rural, white, and Republican respondents. So in contrast, we're seeing that low-income respondents of color, low-income residents in urban areas, renters have much more acute concerns about these same health and safety risks. The next thing I want to talk about is policy support. We wanted to put these policies in front of voters and see their reactions to it. And we do have some really promising results here. The first and most important findings that I want people to take away from this poll is that there is widespread and bipartisan support for the Low-Income House Energy Assistance Program, also known as LIHEAP. When we look at low-income respondents of color, this support is nearly universal. 89% say that they support it. And this is also an area where we're able to reach across the aisle. Although support among Democrats and independents is much more intense, we still see that over half of Republicans, 56%, support LIHEAP as it currently stands. And when testing some other policy platforms, we do see that voters are largely supportive of what we want to be pushing here. For example, we see that 2/3 of voters nationally support updating building codes in their communities to support a more environmentally equitable vision. And an even larger majority of that oversample, 88%, support it. We do start to see an increased partisan divide, but still a net proportion of Republicans, 47%, support it, while 43% oppose. It's a slim margin, but it's still something that is important in my mind. We also see that a majority of voters support the creation of city or statewide air quality standards and guidelines. We do see slightly less support here, but it's still a majority. 57% of nationwide voters supported. And once again, when we're specifically looking at the low-income community, when we're looking at voters of color, 86% support this. So when it comes to the people who are most affected, that's where we're seeing the strongest support for these policies. But then when we sort of ask point blank how voters feel about transitioning public housing away from gas and toward electric heat and power, we see a little bit more of a division. Just under half, 49% of voters nationwide support this, while 40% oppose it. We do have net support, but this margin is slim. But again, I really want to turn to what's notable here. If we look at renters and renters at a nationwide level, they are net supporters. These are the voters who would be most affected by these policies, and they're the ones who are showing the most support. The positive impact is felt among the communities we are trying to reach. In that same vein, we see that low-income respondents of color are overwhelmingly supportive of this transition from gas to electric in public housing. 3/4 support this measure. And when we look specifically about folks who are past or current tenants of public housing, the support is nearly universal. So I'm going to breeze through a little bit of the message testing. We'll be sharing out this presentation once again, so please don't freak out when I breeze by these next few slides, but these show in detail the types of messages that we tested. The thing to keep in mind here is these are all messages supporting the transition away from gas, but focused on different lenses, whether it be the health impacts of children, racial inequity of energy burdens, or creating climate resilience. And what we see is that two really positive things. First is, regardless of the lens that we use to talk about this transition away from gas in public housing, voters are really resonating with our messages. We also see that when we're looking at specific messages, something focused on racial justice and housing affordability perform best. Majorities of voters, over half, I want to show too, that our overall most resonant message, a racial justice lens that focuses on fixing these inequitable health outcomes, is not just our most resonant message overall, but also our most galvanizing message. It's very exciting to see that intensity of support, that 1/3 of all voters really strongly resonate with a message that is putting racial justice first and health equity first. When we look at our oversample respondents, again, those low-income people of color, we see that support for our messaging not only overwhelmingly resonates, we see that these top messages vary by, again, the unique city that we're working in. So what we're seeing here is the amount of folks who consider each message that we tested very convincing. So you see the resonance is really high, where for a lot of these messages, majorities or near majorities say that a message is very convincing to them, but it differs from city to city. In NYC, for example, a message highlighting the disproportionate impact on children's health and future resonates strongest, followed by a message centered on racial disparities when it comes to the cost burdens of energy rather than the disparate health impacts. In Chicago, we see a message focused exclusively on those energy burdens, regardless of who they're applied to. Just cost burdens on all residents delivers the strongest pull. And lastly, in Houston, we see that racial justice message using that health lens is really effective, followed by a message that focuses on building resilient homes and communities when it comes to extreme weather. So we can see that the unique environmental and demographic makeup of these communities also help dictate what messages will be most effective. The other message that we tested that I think is really important to highlight is a holistic framework. We wanted to see how voters react to not just a transition to from gas to electric, but also that being paired with a desire for cleaner, health hazard-free homes. And there is overwhelming support for this holistic framework. We see that 70%, 7 in 10 of our main sample of voters nationwide find this holistic framework convincing. That is the strongest framework that we've tested in this sample. And we see that, too, we're getting a little bit of that reach across the aisle. Just under half of Republicans, 47%, are convinced by this holistic approach, which is incredibly promising. And then when we look at our low-income respondents of color, prioritizing the removal of health hazards is universally convincing. 91% of these folks find this message convincing, and I don't show it here, but this message shows super strong resonance regardless of the city that we were looking at. We also tested a couple of opposition messages here, one focused on the burden on taxpayers, one focused on consumer choice, and one focused on fears around resilient infrastructure. And what we saw is that we do have some challenges, but not necessarily challenges that are impossible to fight back against. Voters do resonate strongly with opposition messaging, with the most prominent concerns being those about the resiliency or the reliability of our current electric infrastructure. And we also see that, despite the power of support messaging when it comes to our low-income respondents of color, opposition points also take hold. But there is good news, especially when looking at the communities that we are implementing these policies in. None of these opposition messages outperform our support. In other words, our support messaging still wins out more strongly. And while we see that, again, arguments about taxes, arguments about infrastructure resiliency are sort of top of mind, at least with our base, this argument about consumer choice, consumers should have the right to select gas or select electric, it's just not as powerful. And in part, that's because many of these folks don't have a choice when they're trying to find somewhere to live. They don't get to dictate what appliances are available to them. So the last thing that we want to discuss is taking action. When we look at the before and after about specifically supporting a transition in public housing from gas to electric, they roughly remain stable. So all of these changes we see here, these slight little dips, are within our margin of error, which means that we don't think that these dips are that significant. And what we do think, though, and what we want to look out for is these little shifts of intensity that are worth keeping an eye on, where we have a lot of strong support at the beginning, we have slightly less strong support after this messaging. And I think that shows that we have some work to do in getting our message out there. There are things about the reliability of infrastructure, the idea of additional cost burdens that really weigh on voters' minds. And we see the strength of our arguments about a holistic health approach that we can use and leverage to keep support for these policies strong. But then when we look at our supporters, there's a strong desire for taking action. So we asked folks who support a transition away from gas, are they willing to do any sort of action to get involved, to push forward this policy? And we see a lot of willingness, particularly in our national sample. What we see is a high willingness to do sort of low barrier to entry actions, signing a petition, talking to friends and family, posting on social media. But we do get a little bit of more reservation when asking about that higher barrier to entry work, like joining a community-led campaign, volunteering for a local organization, or attending a rally. But again, when we're looking at low-income communities of color, not only is there a much higher likelihood of wanting to get involved or a desire to get involved, but they also show a stronger desire to get into those high barrier actions. A majority say they want to join a local campaign or volunteer at a local organization, and nearly half say that they would speak at a meeting to support this transition. So what can we do with all of this information that I just shared with you? Well, there are three things that I want us to sort of take away. The first thing is activating our communities. Renters, voters of color, and low-income voters are the most likely to be concerned about these negative health effects when using gas to heat and power their homes. They are the least likely to have electric appliances in their homes, and these communities are the strongest supporters for electrifying public housing. They also indicate this really high likelihood to take action and show their support. So it will be so important for us to talk to these voters, activate these voters, go into our communities to deepen that support and boost our advocacy efforts. We also really want to lean into LIHEAP. Majorities of voters of all backgrounds show support for this policy that is already in place. And that support is even more strong among the communities that are most vulnerable to extreme heat and energy burdens, those low-income communities. Moreover, this holistic framework that LIHEAP brings resonates so strongly among voters of all types as well. So as the risks become more real for public housing residents and low-income residents, it is essential to demonstrate that LIHEAP is a popular policy that works. The last thing that I would recommend here is us taking charge of the definition of a healthy home. Both voters nationwide and in our key communities share some key visions of what a healthy home means to them. A hazard-free space that provides a sense of well-being and security. In this moment, we have the opportunity to take these key pillars of home health to demonstrate how holistic home upgrades, including a transition away from gas, contributes to healthier homes and healthier communities. I know I went at this pretty fast, but I want to be respectful of everyone's time, and I will lead it back to Yua for the Q&A portion.
That was on mute. Thank you so much, Jessica, for your time. And I just want to emphasize what an amazing presentation you gave that was very thought-provoking and detailed. So coming from that, I would like to kind of kick us off with a question. Someone has posed, well, look, let me phrase this. If WE ACT has looked into sustainable cooling in homes, especially as a means to protect low-income communities. Yes, we have. We have looked at, we have a campaign towards extreme heat, and we do have staff in their state and federal and city team constantly focused, constantly talking about the importance of extreme heat cooling centers, advocacy for the cooling centers. How do we get the word out where people know that there are cooling centers? So yes, we do have much advocacy around extreme heat and sustainable homes. Okay, and back to Jessica. I see you went off camera. You don't get away that easy. So I'm going to ask a question about LIHEAP. Your polling shows bipartisan support for LIHEAP, which is really kind of rare to hear in today's political climate. So can you walk us through what, or do you even know what's driving that cross-party support? And how can we, as grassroots organizations, allied organizations on this call, interested parties on this call, how can we leverage and build that momentum into increasing this federal investment?
That is such a great question, Yua, and something that I've definitely been thinking about. I think something that we saw throughout this poll among voters is, these partisan divides are starting to creep in every aspect of society, especially when it comes to anything related to clean energy. Republican voters, especially in this survey and others that we've done in the clean energy sector, really support oil and gas and show a lot of hesitation to adopt clean energy alternatives. However, something that was really promising here that we can leverage both in the low-income communities and communities of color that we're working in, but also to voters across the spectrum and of all communities, is this unified desire for hazard-free, healthy, and safe homes. This is something that resonated across the aisle, as we saw with Republicans, both when we tested, especially when we tested a holistic framework, and something that LIHEAP does really well, and something that we present when we are advocating for LIHEAP is it's not just about picking one form of energy for another. It's making sure that folks are cared for, folks are living in houses that are cool in the summer, warm in the winter, that they are able to survive these extreme weather and extreme climate occurrences. And this is something that has really surpassed any bipartisan divisions, at least for now. So something that we are doing that I think is really important is that holistic framework saying healthy homes first. And this is a part of that larger vision.
Thank you so much. We have another question. What tools are available for potential renters to filter housing by adherence to these initiatives? So if I hope I'm going to answer this question and understanding it correctly. As a potential renter, when you're looking for a house or an apartment or whatever domicile, the first thing you want to make sure by doing research on the property and the landlord, for one, ensuring that these landlords are, care about their tenants, or the person who is renting the home cares about who is renting the home, cares about the upkeep, cares about taking care of the home. Then you would start to look at the building envelope, the weatherization aspects, the insulation, the whole that holistic approach. And if you can, before you decide to rent the home, maybe you should ask about if that lead testing, lead in paint, lead in dust. If it's available, look at the history of the rental property. In New York, you can look at, a property, see if there are bed bugs, see if whatever landlord tenant challenges they have. So those are the things you would want to do when filtering for looking for a rental property that is healthy holistically inside and out, and within your your range, or wherever you want to live, or things like that. It's not just looking for the facade, but asking questions about what is the overall approach to that property. And I'm hoping I answered that question correctly. And we have another question. I love these questions coming in. Describe the key steps to establish a healthy homes program. Has a documented framework or fact sheet been developed? Well, I think that would be a good question for our communications, but we are definitely developing fact sheets and developing a healthy homes program. Well, We Act has always had this very strong approach to healthy homes. So this has been in a facet since its establishment. So in the creating of a healthy homes program, I think this is being a grassroots organization. It went with what was going on with the community around us and around the organization. Hearing from members, hearing from people affected by what's going into their homes, gave incentive for the organization to build upon this, to make this a larger initiative and develop key frameworks and definitions around how We Act thought of what is a healthy home. And in that definition, it was determined that a healthy home is based on holistic approaches. It's based on not one key factor, such as, it's free from one thing and it may have a little bit of the other. It's a holistic approach of everything should be made: indoor air quality, weatherization, updated appliances, care, and providing for the homes, that there are people that will have to live in the homes. And it's not just a tent or a brick building. You have to live in it. You have to feel at peace within your home. A key facet of a healthy home, and when we even of the legal definition, is peaceable possession of property. So you want to have peaceable possession of your property, and that's holistically. You want to feel safe and relaxed when you go into your home, and not worried about this or that causing you to have any kind of health implications. So I think that was a key step in how to build that campaign, and it came from what was kind of being developed and happening within us and around us, and what are people experiencing, and building off of that. So that was kind of what went into that establishment of the program. Let's see what's going on else. Oh, here we go. As part of the We Act Healthy Homes campaign, what are the primary initiatives to address in-home environmental hazards, such as unsafe drinking water, lead, mold, pests, etc.? Is it primarily through education, policy advocacy, or bridging communities to services to prevent and or remediate hazards? And I think with that question, it shouldn't be like a exclusive, or it should be a both and. Everything needs to be touched on in ways, because everything matters. One thing may affect, everything kind of affects each other. With unsafe drinking water, you have risks of bioaccumulated long-term poisonings, long-term health degradations with lead and mold, and breathing that. Lead isn't also in drinking water, so it's not just in one thing. Everything kind of impacts the other and comes into a big snowball effect. Without proper weatherization, that can bring pests. Without having proper insulation and closure, so I think all of it needs to be addressed. It doesn't have to be like this either or. It can also be a both and when doing advocacy, it's always best to educate while advocating. Because a lot of times we think that council and political leaders are well versed on all these topics, and they may know, but they may not be well, as educated as somebody who is doing this every day, who is building their career upon this. So it's important that we educate while we advocate and show the need for these legislations, these impact-driven policies. So I think also you have to bring in the community, because who's being affected? The community. So I think that's all an inclusive part of building the campaign. Don't having to feel the need to focus on one, but seeing it as one thing affects another. So include it all if you can. And our last question: how are homes evaluated for inclusion in a Healthy Homes program? How are residents or tenants selected or targeted or incentives? Well, we did have our Out of Gas program, and that had a specific target, but with the Healthy Homes program, it's not necessarily that a specific residents or people are being targeted or incentivized. It's a call to action and saying that healthy homes matter in a holistic sense, and advocating and lifting that up to the community. We're not selecting different homes to uplift or anything like that. It's basically an overarching campaign to educate, advocate, and build more legislative policies. And now we're going to wrap it up. So hard to say goodbye. So first, I would like to thank all the speakers and all of our participants for being here today. Healthy housing is the front door to opportunity, to resilience, and to justice. And we're so glad you were here to walk through this and our the polling results with us. So again, why does this campaign matter? Just to reiterate, we're at a crossroads. Either we move forward with policies and investments and center people in equity, or we continue allowing injustice to be built within the walls of our homes. So Healthy Homes First is how we will change that. So how do you stay informed? Well, we have our slide here, and it's saying that you can always visit us at healthyhomesfirst.org. And we have a take action. You can sign up for updates and follow us on WEACT for EJ and hashtag Healthy Homes First. So you can use your voice and use your platform to influence and demand more healthy advocacy and make this a reality. And you can join us, collaborate with us. We're loving that. So let's keep fighting for homes and that are healthy and safe, for energy bills that don't break the bank, and for policies that don't leave our communities behind. So we're ready. So let's build it together. So I thank you all again for being here, and have a wonderful rest of your afternoon. Thank you so much.